So as of today, we have 15,970 confirmed COVID-19 cases that have been identified in Buncombe County. 294 COVID-19 related deaths have occurred in our community, and currently we are seeing roughly about 20 new cases per day enter our public health workflow. That's a decrease of almost 70% since the last time I came to present to you all. And our new cases per 100,000 per week as of today is 57. The epi curve is showing, after a short plateau that we talked about last time, what appears to be a slight dip again, and so you can see far less activity on our epi curve. Our percent positivity is stable. It is consistently below 5% for the last few weeks, and last week it remained between 2.8% and 3.1%. Today's value is 2.9%. The regional hospitalizations also continue to show some stabilization. Just as the epi curve in the last few days, there appears to be a very subtle dip, but much more of a flat line. And I think it's wanted to, let me see, let me go, there was, I'm sorry, those were a little out of place. I apologize for that. I did want to share the COVID-like illness that we haven't looked at in a while because we've been focused on some other indicators, but I did want to show that the COVID-like illness, which is one of our early indicators, you can see the same type of trend that we saw with the epi curve, that we see marked decrease here. I think it's also interesting to note, though I didn't add it today, that the influenza-like illness surveillance report 2, what's really interesting with that data that DHHS captures in their surveillance report is that there's very little flu activity right now. And I wanted to highlight that and show that I think one of the contributing factors there are the precautions that we have in place for COVID-19 are impacting other viral transmission. So I'm going to go back one. Our local trends have fallen to levels consistent with before the surge. Our new cases per 100,000, and just a reminder that the table that you see here is pulled every Monday for you all, so it's from week to week. The new cases per 100,000 has fallen steadily over the last couple of weeks, and our percent positivity, as mentioned previously, remains stable over the last week, hovering around 3%. Our testing numbers have declined, but for comparison, our weekly average for the last few weeks has been 6,229. During the surge, this average was 9,676. Prior to the surge, the weekly average was 6,400, and compared to back in the summer when it was 5,334. So while current testing is less than what we were seeing in the surge, it is comparable to what we were seeing pre-surge and still higher than what we were seeing in the summer bump, if you'll remember. Seeing our trends come back into a more favorable area is welcomed, but it does worry me just a little that folks will see all this green and become complacent and forget that it is still very important to follow the 3 W's, that if we want to see these trends continue in this direction, that we cannot stop doing the things that matter right now as we continue vaccine rollout. So just want to make sure that I put it out there that for folks to continue to wear their masks, continue to stay 6 feet apart, continue to wash your hands, and limit your interactions with others. So I did want to mention also that we are starting to see the impact of a vaccine rollout in our new cases for those who are 65 years and older based on statewide data, that over the course of the surge and how it's come down, we have seen all age groups have a decline in new cases, but our over 65 population has seen that more rapidly and more pronounced. And we do believe that is the impact of that those first rollout of vaccine, that we're seeing less and less of our 65-year-olds with new cases, which is wonderful to hear, as that was one of our groups with the highest risk of severe illness if they were to contract COVID-19. And on the state call today, they also mentioned that for long-term care facility cases, for long-term care facility clusters and outbreaks, we're also seeing that come down as well. So all good news that we do think is impacted by vaccine rollout. So while that is really great news, we are not seeing immense impact yet in the general population for vaccine rollout because we're just starting more of that general population. So that's why, again, it's really important for folks to remember to practice the 3 W's so that we can continue to see our trends stay in this green area and hopefully reduce it even further. So please do not become complacent. And as a reminder, North Carolina is currently vaccinating groups 1, 2, and 3. And Group 4 will open first to adults with high-risk medical conditions, those experiencing homelessness, and the incarcerated on March 17th. That is tomorrow. Our wait list will go live tomorrow morning at 8 a.m. for this new group of folks who are eligible. I just wanted to give you a quick update too on our current wait list. Our wait list is considerably less than what it was just a few weeks ago. We were able to identify thousands of duplicates, and with our new unsubscribe function for the wait list, folks are able to remove themselves and still call us and remove them. We can remove them as well. That also resulted in thousands of folks coming off of the wait list. And so prior to entering into Group 3, this left about 16,000 individuals still on the wait list. And with the addition of Group 3, we added about 4,000 or so, give or take, individuals onto the list. So our team has continued to work the list down for appointment scheduling, and now we are scheduling in the 57,000 range for confirmation numbers. The highest number on the list is 65,557, and so just note that that does not indicate the total number on the list. That is the highest number for which we have assigned. And the total number of active individuals on the wait list is 14,676 as of this morning. So we are continuing to work that down as we now enter into Group 4 tomorrow. So as of yesterday, our state had administered over 3.1 million doses of vaccine, and this translates to almost 20% of the population receiving at least partial vaccination and over 13% having now been fully vaccinated. And this is a slight change in language that I did want to bring to everyone's attention with the introduction of the Johnson & Johnson 1-dose vaccine. You might have remembered that it was first dose and second dose is the way we talked about it. Now with the introduction of a 1-dose vaccine, the state has changed their language to partially vaccinated and fully vaccinated, and we will do the same for our numbers so that we can compare apples to apples. So among all Buncombe County vaccine providers, over 83,000 total vaccines have been administered. This equates to 19.8% of our population achieving at least partial vaccination, and 12.2% achieving full vaccination. So for Buncombe County HHS, as a single provider and our partners at Emergency Services, we've administered 44,246 total vaccinations, and we have been tracking our equity work as a vaccine provider, and what you see here is specific to Buncombe County HHS efforts. And just to point out that we did separate this so that you can see the 65 to 74-year-olds and then the 75 and over. And what you're seeing here is the total population being a little over 239,000 based on the data we were using. And roughly 91% of that estimated to be white. When we look at the breakdown by age, we estimated that roughly 52,000 1,000 were white and 65 years and older. Breaking that down further for white and 65 to 74, we reached 33.2% of that estimated population, percent of white and 75 years and older, 35.5%. And then with our African American Black population, about 6% of the total population, which is roughly about 15,000 individuals. When we looked at that age breakdown, percent African American Black, 65 to 74 years receiving one dose, we're almost 26% of that estimated population. And percent African American Black, 75 years and older, also almost 26%. That is not a typo. The math really did come out to be the same. And then this has increased in just the last couple of weeks when I presented to you last, when it was about 22%. And our recent equity bump allocation has been used for the last couple of weeks to help engage and vaccinate our Latinx population who are eligible. And when we use the Office of State Budget and Management demography estimates, there's not an age breakdown there. But we do have the total population information, which is roughly 10% of our population identifies as Latinx, which is a little over 23,000. And of that, we have percent Latinx receiving first dose is 3%. You might remember a couple weeks ago when I reported this, it was 1.4%. So our equity efforts we're seeing the dividends of that equity work. I didn't put it on the slide, but I did want to update you all on the long-term care facility work too, because I know that's been of great interest to you all. And that regarding the federal long-term care facility program, all the facilities that are in that program have received first and second visits, with many of them receiving their third visits, which will be their final visits. The state continues to track that progress on their state vaccination dashboard. Over 127,000 first doses have been administered through that program, and over 102,000 second doses have been completed. And this is indicative of about 80% of that allocation to that program. And locally, for those long-term care facilities that did not participate in the federal program, they were the responsibility of the local health department. 82 facilities were identified by the state for the responsibility of the local health department. 47 of those long-term care facilities have been completed. 16 have received their first doses. 18 declined or did not respond to Buncombe County HHS outreach. And additionally, our staff who were working on that project identified 26 additional facilities of congregate living, and that were not originally on that state list. 8 of those have been completed. 18 have received their first dose. And those congregate care facilities range from small family care homes to alternative family living homes. And they're usually smaller in bed size. And just to note, we're vaccinating both the staff and the residents of those. So we are currently working on opportunities to also vaccinate our homebound individuals in partnership with Meals on Wheels and Mission Care Medics. We'll be plugging into their existing routes to provide vaccine for those who wish to receive it, and so there's more to come on that as we continue to plan. And now on to vaccine allocation. We were expecting a new 3-week allocation notification last week, but then the state said we're going to extend it 1 week. So what we got the previous 3 weeks is what we got this week, which is current baseline of 2,340, which is still 2 trays of Pfizer. In addition to the baseline, we've received another 300 equity allocation. And just to remind you all, the intent of that allocation is to provide access in addition to your baseline to historically marginalized populations, which you've seen in previous presentations how we've done that. This week we'll continue to engage and vaccinate our Latinx population. In addition to these allocations, we did apply for a one-time special allocation of 1,170 to use for their school staff. This special allocation will allow us to finish our school staff list without taking away from our baseline. So we can apply all of our baseline to our wait list and those on there. And then North Carolina DHHS is expecting to send out the 3-week allocation for next week and the 2 weeks after today. I had not received it as I came into this meeting today, but we should receive it today and find out what we'll be getting for the next 3 weeks. I did just want to mention as well that we are in discussions with our hospital partner, HCA Mission, about vaccinating the homeless and incarcerated as we enter into Group 4. And the last thing I wanted to mention around allocation was that last week, in addition to our baseline and our equity allocation and a transfer from Mission of 1,000 doses of J&J, which we incorporated into our schedule, we received an unexpected allocation from North Carolina DHHS of 400 additional doses that we weren't scheduled, we had no idea that those were coming and had not scheduled those. So what we did decide to do with those is pilot our very first transfer to a provider. So you might remember we've been taking or accepting lots of transfers, but this time we got to pilot a transfer to another provider, and it went really well. We transferred to area pharmacies 200 doses to Health Ridge in Black Mountain, who has scheduled their appointments and successfully put their shots in arms, and then 100 doses each to Ingalls pharmacies, one in Weaverville and one in Leicester, so that we had some coverage around the county, and it went really well. So we're hopeful, based on the success of that transfer pilot, that if we were to find ourselves in that position again, that we'd be able to continue to transfer vaccine to other providers to increase the access throughout the community. We continue to administer most of our first doses at the AB Tech with outreach events for equity purposes, sometimes elsewhere. And we will be transitioning to the Biltmore Church South location on March 19th to begin use of that as our second dose site beginning March 20th. So we'll take 1 day to transfer everything over and begin doing our second dose vaccinations on March 20th. And just a reminder that we do have additional vaccine providers in our community. Hospital and local health departments were the first brought on, but then FQHCs and now some pharmacies and other groups are being brought on. And so folks can check out myspot.nc.gov to find a vaccine provider. And while we focus a lot on vaccine right now, I do want to remind folks that if you are experiencing symptoms or think that you have been exposed to COVID-19, it is best to get tested. Testing continues to help us reduce the spread, and testing is available at AB Tech on Sundays via StarMed, and more information on testing with StarMed can be found at starmed.care. And as we are in the month of the anniversary of many things, COVID, I did want to take a moment to recognize and acknowledge the leadership and sacrifice of our community in this year. I also wanted to acknowledge the hard work and long hours of not just HHS, but emergency management and all of our other COVID response partners in this last year. So thank you.
Thank you, Stacy. Commissioners, are there any questions?
I had a quick question, or maybe two. I guess first of all, is it your understanding that Mission Hospital is going to continue to get vaccines on a regular basis? And I guess where I'm going with that is, you mentioned the homeless population and the Johnson & Johnson vaccine. That seemed like the ideal vaccine to me for that population. And so I guess my question is around Mission Hospital and vaccinating our homeless population.
Yes, so for populations that it might be harder for us to get for a second dose, we would prefer for Johnson & Johnson. I apologize, I keep calling it J&J, Johnson & Johnson. And that's what we're talking with our hospital partners with is when, if, and as they receive Johnson & Johnson through regular allocations or through special allocations, working with them to best use that Johnson & Johnson for our homeless population, our incarcerated population, because it does make good use of that vaccine in certain populations.
And Mission's going to continue to get shipments as far as we know?
As far as we know.
Okay.
Mm-hmm.
Stacy, when you reported on one of the slides, the Buncombe numbers, separate from Buncombe DHHS, is that coming through the state site? Because we know people are leaving the county border to get the vaccine. So are we able to account for that?
We are able to account for that. So those numbers that you're seeing on that slide, and
Oh, just missed it.
apologies.
It is.
Those are what we put into the CVMS system, and then we pull that report back out for our use. And when we stratify that by where their county of residence is, or where their residence is, 94% is Buncombe County residents. 6% is outside of our county, with most of that being our surrounding counties. And I believe the last time we checked, less than 1% is out of state.
Thanks a bunch.
All right, any other questions? All right, Stacy, thank you so much.